Hi, my name is Julia Puebla-Fortier, and I am the Director of DiversityRx and the Your Voice Project, and I'm very happy to welcome you to the DiversityRx Your Voice webinar series. As you know, this is a monthly series on how good practice and policy and research can improve healthcare for culturally diverse populations, and we're very pleased to be sponsored by the California Endowment for these webinars. For those of you who don't know us already, DiversityRx was started quite a few years ago, and we do a variety of different kinds of projects, including policy development, research, and education for a very diverse community of people who work with culturally diverse populations. Among the kinds of things that we're able to offer are a website, DiversityRx.org, the Class Talk Listserv, which has over 1,600 participants, and a conference series on culturally diverse populations, and we're going to be having our 7th conference in Baltimore this year. And then, of course, the Your Voice webinars, Communities of Practice and Peer Learning Networks. So I'd like to just start us off with a few little technical details so that you know how the webinar is going to work. We're going to have our presentations first, and then we will have a Q&A session towards the end of the webinar. So just so that you know, as the audience, because there are so many of you, we mute the audience at all times, but you can use the question window at the bottom of your control panel to submit questions at any time. And if you'd like, you can indicate if you want your question to go to a particular speaker. So here's what the control panel looks like. To ask a question or send in a comment or suggest a resource, you can enter it into the questions pane. And you'll see where it says questions, there's either a minus sign or a plus sign. If you see the minus sign but no place to type anything in, then just click that and you'll be able to see it a little bit bigger. And then we will field all the questions and we will forward them to the presenters and try to answer as many as we can. If we don't get a chance to get to all of the questions, we will ask people to be patient with us and to know that we are actually going to make sure that all of the questions go to the panelists, and then we frequently have the panelists answer a few additional questions after the webinar is over, and then we will send those out to you. So another little tip that you might want to keep in mind is keeping track of the GoToWebinar control panel. You'll notice that up at the top, you will either have a very skinny little thing that has 2 arrows and a window and a microphone on it, and if you click on that at any time, it will expand, and it's the expanded view that is really much more helpful. So if you go up to the top where it says View, and you click on the auto-hide the control panel. Actually, you don't want to click on it. You want to make sure that it's not clicked. That will keep your control panel visible at all times, and then you can see the dashboard, the question panel, the audio details, and things like that, and that will be much more helpful for you. So what I'd like to do now is just review the agenda with you. As you know, this webinar is called Best Practices for Working with Healthcare Translation Providers, and we have 3 excellent presenters today. Natalie Kelly, who's a Senior Analyst with Common Sense Advisory, Nye Kasich, who's Director of Health Promotion and Cultural and Linguistic Services at LA Care in California, and Carolyn Wang Kong, who's the Practice Leader for Language Access Issues at Kaiser Permanente. And they will be doing their presentations, and I will start off by introducing Natalie in just a second. And so if we can go forward then, let me just tell you a little bit more about Natalie. She is a very well-respected author, a consultant, and an advisor with a specialized interest in interpreting services. She wrote a book called Telephone Interpreting, A Comprehensive Guide to the Profession, and it was one of the first full-length books ever published on the topic. She's often cited as a subject matter expert in a variety of publications such as Business Week, the New York Times, and the Washington Post. And her work has also appeared in leading healthcare industry journals, including Health Affairs and the Journal of Healthcare Law and Policy. Natalie is assisted in the design of language access curriculum for Georgetown University Medical School, and she's an invited member of the National Project Advisory Committee for a web-based training program on culturally and linguistically appropriate disaster response offered by the Department of Health and Human Services Office of Minority Health. She's also a former Fulbright Scholar in sociolinguistics. She's done a number of research studies on translation quality, terminology management, and a variety of other topics in the area of language services. So I'm going to turn things over to Natalie, and then she will introduce our two other speakers.
Great. Thank you, Julia. And thanks, everyone, for attending today. So our goal today is to provide you with some basic information and tips for working with healthcare translation providers. So because we have two excellent speakers who will be presenting case studies from their real-world experience, what I'll be doing is first providing you with a bit of context about the translation market at large and working with translation providers so that you'll have some background information. So as many of you know, Common Sense Advisory is an independent research firm. We are devoted exclusively to the language services industry. So a great deal of the information and specifically the data that I will be showing you today will come directly from some of those research publications. So I'll make sure to reference any reports that I cite as I go along. But because we are covering a vast amount of information in a very limited time frame, I wanted to first make sure everybody knows that you will have access to copies of our slides. They're actually currently available on the DiversityRx website. And also, just to let you know, we're only scratching the surface on many of the topics that we'll be addressing here today. So on the bright side, I hope that even though we won't go into a lot of depth on each and every topic, this webinar might serve as a springboard for further discussion on the topic of written translation in healthcare. So I'd like to start out by pointing out that we'll be focusing today on written translation, which is very different from spoken language interpreting, which, although sometimes is also referred to as translation, is a completely separate profession. So everything that we're talking about here today refers to written translation, not spoken language services. In fact, we could do probably a separate presentation just on the differences between those two things. So the slide you see here actually shows you the various project participants that are typically involved in a translation process. So this gives you a sense of how different interpreting and translation really are. Now you might ask yourself, why are there so many people involved here? Well, this is a best practice scenario. So this shows you what is the best practice, but also what is most common in the translation industry. Now I will go into the details of the nature of the industry in a second, but I first wanted to show you some of the different elements involved in a typical translation project. So one thing to know is that translation is always a team-based endeavor, and this is very different from interpreting because interpreters are often on their own and delivering information in real time, usually in healthcare settings for one person at a time. Translation, on the other hand, involves multiple parties. So as you can see here, there's 3 different levels of participation. So when I speak with healthcare audiences that are relatively new to translation, most of the ones that I talk with typically only think about the production side. So as you see here at the bottom, these are the production aspects of translation, so what it takes to get the information actually produced in another language. But what organizations often forget are these top 2 levels that you see here. So we have the review phase, and that doesn't mean just proofreading and editing, which is actually part of production, as you see below, but actual client review, so the organization's internal staff or sometimes members of the actual community. The other piece that organizations don't often realize is part of translation is the management aspect. So depending on the size of the project, there may be a production manager involved to manage all the different parties involved in production, a project manager. Sometimes there might be one project manager for every language or one production manager for every language, and sometimes other parties as well. Now, the process participants that you see on this slide refer to language service providers, but the same types of participants are needed even when an organization uses their own internal staff. The difference might be that sometimes the internal staff might be carrying out many different roles. So they might be doing proofreading, they might be managing the vendors, they might be doing various different things. So now I'm going to just walk you through some of the typical steps in the translation process so that you understand what the translation providers are typically doing behind the scenes. So we don't have time to go into each step in a lot of detail, but what I can share is that these steps are essentially the same whether you're looking at a professional translation company or some combination of internal staff and freelancers and a professional company as well. So we always look at authoring as the very first step to translation. The more involvement there can be at the onset, the better. So getting the translation team involved in actually producing the source language content can ensure a high level of translatability. Now this is rare, unfortunately, but this is the best practice. This is actually what we recommend. So this relates to, obviously, comprehension, health literacy, and general literacy as well. So the next step is the analysis step, and this is where a lot of projects really, truly begin, followed by a quotation and scheduling phase. So based on the analysis and the complexity of the project, how long will it take to translate this material? What are the timelines? What are the needs? Then the third step, the fourth step, based on the requirements, the team is selected. And here we don't just mean the team of translators, but also the editors and the proofreaders who are involved. Because there usually are, as I mentioned before, multiple parties. Any material that's going to be published needs to be reviewed by multiple parties. So just like we wouldn't publish a patient safety pamphlet in English without having a multi-phased review process, we need to apply the same care and attention to detail in other languages. You see a term here, it says TM files. What that means is translation memory. These are very commonly used in the industry. Basically, they're electronic databases with previously translated phrases. So that's a best practice to use translation memory files. And professional translators actually learn how to use these tools in their university courses, and it's a basic job expectation for them to have this software and apply the previous translations to the new ones. So this ends up saving the organization money, but more importantly, it also improves the quality to make sure that the same terms and phrases are translated the same way repeatedly and to minimize confusion for the patient. So these are the electronic resources that are used at this phase with any other style guides and reference materials that are shared with the team when the project and the team are set up. So then we move into the more familiar steps of the translation process. Production, as you can see here, typically consists of what we call TE, which basically means translate, edit, at a minimum. So TE, and you'll also see P, which stands for proofread sometimes. So that's the minimum current industry best practice, translate, edit, proof. It's a very common acronym in the field of translation. So basically, the information is translated by one person and then edited by a second person. So that's the production step. Then we move into review, which is when the client reviewers and the community reviewers, if there are any, will check the translation to make sure it's clear, can be understood by the target audience, and does not have any double meanings or unintended consequences for the audience. Then the feedback from the reviewers is incorporated into the translated text. The files are formatted in the desktop publishing software, and then at that point a proofreader will review the formatted files, checking all the numbers, making sure that a text box isn't on top of another text box, and things like that, just in general reviewing the quality of the output. Then these files are converted to the right format. It might be a PDF file. It might be it's going to be sent to a printer, perhaps a high-resolution format. And then lastly, the files are delivered to the organization. So at this stage, the team usually reviews the process to see how things might be improved next time working with this particular customer. So, for example, when the review took place, did the reviewers provide changes that were really not necessary? That's a common thing that happens. If so, maybe the instructions need to be updated for the reviewers. So things like this get addressed as part of the post-translation delivery review. So now I'll just give you a sense of the industry. So this is an industry that is characterized by many, many small companies. So that's the norm in the industry. There are thousands and thousands of very small translation companies, and here you can see a map that shows some of the clusters in the United States and Europe. But the fact is that they're located all over the world, not just within the United States and Europe, although they do combine to account for about 70 to 80% of the demand, or the supply, I should say. So this just gives you a sense of how common these companies are. So basically, they're located around the world. It's a global industry with thousands and thousands of small companies. And they in turn work with tens of thousands of freelance translators and freelance editors and proofreaders, desktop publishing specialists, etc. So most of these companies actually have fewer than 5 employees. And those employees are typically project managers, vendor managers, and salespeople. So we often refer to translation companies as project management shops because in spite of the fact that they are translation companies, the bulk of what they're really doing is not just the translation work, it's actually managing and overseeing the whole process. So this slide gives you a sense of the pricing in the industry. This is a table from a report that we published in 2008 on the price of translation, and it shows the average pricing for 10 different language pairs to and from English. We actually have this data for 74 different language pairs, but this gives you a snapshot of some of the most commonly requested languages. So as you'll note here, the price for translation depends on the direction, whether you're going into European Portuguese or into English. So when we did the research for this report, we obtained actual price quotes for translation projects from 292 translation companies. And the prices you see here are the average per word prices. Per word pricing is the most typical unit for translation projects. So they can be priced by the line, by the page, by the hour, by 1,000-word units. There are many ways of pricing it, but the majority of projects are priced by the word. Now, you won't just pay for the per word pricing. For most projects, you're going to be paying additional fees. So this slide shows you some of the most common ones to watch for. On top of the per word fee, you might find yourself paying extra if you have an urgent timeline, if you have paper documents, and you will typically pay for project management as well. So one important thing to know is how the salesperson views you as a healthcare organization in terms of all of the other accounts that they could be selling to. So the perhaps unfortunate reality is that most salespeople are looking for the highest amount of revenue when they're looking for projects. So healthcare projects are typically very small. They usually fall into the category of undesirable for a lot of companies, especially the large companies, because some companies, like we talk with some of the top 30 companies, will say, we won't even look at a project that's less than $50,000. So that's something very important for you to know so that when you're negotiating with vendors, you can come up with different ways of guaranteeing them the volumes that will make your business attractive to them. So when you're talking with vendors, a few things to keep in mind. First of all, do they know the business of healthcare? Can you get any references from any of their other healthcare clients? Can you see any samples of past projects that they've done that might be similar to the ones that you'll be doing with them or that you hope to do with them? Also, can they give you any transparency about the translators and the individuals that will be working with you? It says here translators, but project managers as well, since you'll be working primarily with your project manager, your account manager. Now, another question to ask is how much experience you actually have with translation. There are a lot of interpreting vendors as well that offer translation services. Not all of them will have a great deal of experience with translation, so it's very important to ask them, just as you would a regular translation vendor, what type of translation experience they have, and ask them the same types of questions as if they were any other translation company. Availability is another key thing to look at, especially because this is a global industry. You'll want to make sure that they have individuals that can communicate with you in the same time zone. So, if you're based in California, they're based on the East Coast, will they have someone who can take your calls at 4 o'clock p.m. West Coast time? And also technology, and I hope at some point DiversityRx might offer a translation technology webinar. This is a very important topic that I hope all of you will be able to learn more about. But a basic question in the technology area is, will you provide me with the translation memory files? This is very important. These are your resources, so you should be provided with the translation memory files, if any are created for your projects. And then also, what types of pricing options do the vendors offer you? So are they going to charge you a minimum fee for every project, which is very common, or is there some sort of monthly volume that you can guarantee to them in order to waive those minimum fees? Most projects, as I mentioned before, are quite small. So is there any way there might be a retainer possibility or batch processing or some sort of creative solution in order to help you get the best price? So very important, and I'm sure Carolyn and I will speak a little bit about this, the relationships with your vendors, your translation vendors, are very key. This is not a vendor that can be just replaced from one day to the next with great ease, because they do tend to learn a lot about your processes, your content, your internal structure. Also, they become familiar with managing your different resources, style guides, terminology assets. And so this is a very important consideration when dealing with a translation vendor. It's not a short-term relationship in general. And you can work with multiple providers. It's very common to have multiple providers, especially for different languages. Some companies do tend to specialize more in certain languages than others. So that's a very common phenomenon that we see with buyers of translation services. And then just a quick word about sample translations. We strongly recommend using sample translations as a way to evaluate quality of potential vendors. We don't recommend using it as a way to get a free translation. This really should be a true sample. So testing the quality, we recommend that you use a previously translated text, usually short, 1 or 2 pages, so that you can evaluate how well this translation stands up to perhaps a past translation and compare apples to apples. You also will want to find internal or in-community reviewers to give you feedback on the quality of the translation. And when you do use internal reviewers, make sure to provide them with specific instructions about how you want that review, what kind of feedback you want, and what things you don't want. So if you don't want a subjective type, I prefer this word over that word, then you need to be very clear to make sure that they give you the right type of feedback. So just in general, back translations are not recommended as an industry best practice. Typically, they introduce errors in the process of doing the back translation, so they're not always necessarily a good way to review quality. But they can be a good way of getting a gist of information. But sample translations are a much more reliable way of doing quality checks when you're evaluating vendors. So those are all the slides that I have. So I'm going to pass the presenter spot over to Nye Kasich. And just a quick introduction for Nye. So Nye is the Director of Health Promotion Services and Cultural and Linguistic Services Department at LA Care. She's responsible for the translation and interpretation services for nearly 800,000 Medi-Cal, Healthy Families, and Healthy Kids members in Los Angeles County. Her responsibilities also include provision of culturally appropriate health education services and resources for LA Care members. Nye has worked with vulnerable and culturally diverse populations in healthcare settings for 11 years. She's also worked to train low-income people of color to entry-level healthcare jobs and advance their careers through healthcare ladder training programs, which Nye developed as an executive director for nonprofit agencies. So I will go ahead and hand it over to Nye.
Okay, thank you. And I'm sorry, Natalie, I can't find my slides on the screen. It just went blank as soon as you finished your presentation.
Oh, okay. So let's see if we...
Nye, this is Ann. I'll go ahead and I'll run the slides on my side of the house.
Okay, great. Thank you, Anna. So thank you so much for inviting me to share some of our best practices. I just wanted to kind of give you some background information about LA Care. LA Care is a not-for-profit health plan in LA County. We have about 800,000 members, and as you can see, our membership is diverse. We have, hold on. Okay, next slide. And we have about 48% of our members who are English-speaking, and more than 50% are non-English speakers, Spanish being our high-volume language, Armenian being very distant third, and then we have Chinese and other Asian and European languages. Our department is in existence primarily because we have state requirements for making member-informing materials available to our members. So essentially, there are 7 categories or 7 different types of documents that we have to produce and make available to our members. And so it ranges anywhere between a page to a 150-page document. Next slide. Great. The question is translation outsourced or is it done in-house? When I came on board, well, let's see. Currently, in 2009, we actually translated 1.5 million words. These are the required documents and other marketing and health education materials that were translated. This number does not include any documents that were reviewed, so we have a separate count of the number of words that were reviewed. This includes translations, the entire translation process that Natalie has spoke of. There are different phases, and for within our organization, there are 7 steps. So there are 750 documents that were translated in 9 different languages in 2009. We do have some limited, we do some limited translations and review in-house, and they're really, really minor. I would say maybe less than 1%. They're primarily flyers or just a small section of a letter that needs to be translated in Spanish. And we have a Khmer-speaking individual on staff who conducts some review for us. But for 99.9% of our work, they're all outsourced to outside agencies. So do we have agents, do we work with agencies or do we work with freelancers? When I came on board in 2007, LA Care had 24 vendors, 24 different agencies that provided translations and interpretation services. Majority of those 24 were actually translators or translating companies. And so LA Care had over a dozen different individuals that we contracted directly with. And an organization that was 10 years old, it was an appropriate place to be. We actually had individuals that we could communicate directly with in terms of expectations. We knew that when we sent out our work, the same individuals would be translating, so those are all positive things. Those individuals understood our organization. They had institutional knowledge. So those are all assets. And also, working with individuals, we were able to receive lower rates because they didn't have the overhead. They didn't have other expenses except for whatever they needed as individuals. But there were also limitations, too, with working with individuals. Their IT or technology capacity was limited. For instance, like with emails, we would email files back and forth. So if you have a 30,000-word document, it often caused problems because, you know, their email would be full and wouldn't be able to accept our document, or if they had sent something, for whatever reason, it would be bounced back and we wouldn't receive it on time. They also didn't have access to some of the technology, transition memory Natalie had mentioned. So we were literally paying for each document to be translated, even if there's significant similarities between one letter to the next letter that needed to be translated. And we found that our organization would have to do quite a bit of coordinating and overseeing when we worked with independent consultants. So for instance, we would have one project where we would receive a bid from different translators, send it out to one translator, receive it back, and then send it out to a different translator for a review, and then we would have to bring it back in-house for quality assurance. So it administratively took a lot of time, and we found that for our organization and the growing volume, it wasn't cost effective. So in 2008, we issued an RFP, and as Natalie was saying, she was right on about having a long-term relationship. We really saw this as an opportunity to identify agencies that could work with us on a long-term basis. I actually referred, during the RFP Q&A section, as a marriage, because we actually saw these agencies as an extension of our organization, of our department. So after several months of kind of reviewing proposals, hearing presentations, and viewing some sample translation work, we executed a multi-year contract, 3-year contract with 3 different agencies. And it just so happened that one was a small, the other one's medium, and the third was a very large organization. And we didn't do it intentionally. Our goal was to find strengths in the various organizations that would meet all of our needs. It's kind of like you can't find one person or one agency that would meet all of our needs, and so we really looked at the strengths that each of the organizations, each of the 3 organizations that brought to the table. And we actually, to this day, kind of calendar our project based upon their strength. So, for instance, with marketing materials, we send the marketing material to one particular vendor on a regular basis. And as we have formed the relationship, we were very clear in terms of expectations, wanting to have the agencies use the same linguists or same translators to translate for us. In the process of executing a multi-year contract, we didn't need to have to go through the bidding, and the invoicing became quite easy for us. With independent contractors, we wouldn't receive invoices timely, and so that caused a bit of a challenge for us from our end because we receive monthly variance reports, and if the invoices didn't come in, it showed that we didn't spend the money. And if all the invoices weren't accounted for at the end of the fiscal year, then that could have been a problem for us. And so in many respects, it has worked out for us to work with 3 agencies instead of having individual consultants. Now, in terms of pricing, we do pay a little more to the organizations, but we also see that we're also receiving other services. Some of the cost items that Natalie mentioned, like project management fees, minimum charge for translations, we do pay for those, and in many ways we feel like it's fair because we're receiving other services by working with these agencies that have the infrastructure. So, you know, one of the big things that we have talked through and agreed with our agencies, the 3 translation companies, is that we really prefer to have same team of translators translating our projects. And of course, you know, there are no guarantees because independent consultants work for many different organizations, and if there aren't enough work coming from that agency, then there's a good likelihood that they would go someplace else. And so with the 3 agencies, we try to keep the workflow on regular and consistent basis. And the fortunate and the unfortunate situation is that many of our mailings, the required mailings, are annual mailings. And so as soon as one job is done, we're ready to, you know, send out another set of documents for translations. And so I think we've done a fairly good job making sure that we had enough work for each of the companies so that they feel like they could, as best as possible, keep the same team of translators available to us. One of the things that we really have enjoyed is the way we communicate with our agencies, with our vendors. They have what's called portals, and so we're able to just kind of list out our expectations on the portal. It's a very easy way of communicating back and forth. Rather than emailing, using our email system to email back and forth documents that are as large as 30,000 words, we use a portal so that, you know, we don't have the mishaps of documents coming back to us. And this is an area where we actually worked proactively in making sure that we were clear about our expectations. So we developed a checklist, and this is a checklist that's a living document. We've actually received feedback from our vendors and our internal departments. And basically what it is it's a checklist of things that they need to review before everything is sent to us. Like examples would be, did you use a correct font? Was there any corruption? Was there formatting? Was the formatting reviewed? Was a Word document attached? Was a PDF attached? So there's a series of items that we required within our organization to make sure that all the due diligence were there, due diligence were conducted before the documents were returned to us. Next slide. What do agencies offer that's worked? All three agencies have been great in that we're able to provide or forward large volume requests. So this is a challenge when we had consultants, because with individuals, if we needed them to work on evidence of coverage that was about 150 pages thick, then we couldn't send other documents, like maybe marketing document or health education materials, their way. We would have to find other agencies. But what we're able to do is we're able to coordinate in advance with our agencies to say, okay, well, we have these documents coming your way. What can we do to accommodate? So it's worked for us really well in terms of communication and coordinating with our agencies that have access to multiple linguists. Quality assurance, when we're going through our RFP process, we were looking at quality assurance heavily because we know that you have good linguists, good translators, but it's the mechanism, the process that's in place within any organization that's going to ensure quality. You may have people come and go, good translators come and go, but if there are multiple reviews or multiple levels where review is conducted, then we have a greater chance that we'll have a quality product. And so, so many of the companies that we selected had very strong quality assurance process. Not to say that there aren't mistakes, sometimes there are. It's just inevitable because we're human. But we've been able to reduce quite a bit of error, quite a bit of misstep, because the agencies that we work with have quality assurance process in place. The other we ask in terms of quality assurance is making sure that their linguists or their translators are assessed appropriately and there's regular training. We want to make sure that folks who are out there are professionals who are on top of new practices and any requirements. And we, as part of our review process, we actually use evidence-based tool. Hablamos Juntos, which is a nonprofit agency in Central California, has developed a tool, a quality assurance checklist for English and Chinese, and we've actually required our vendors to adopt and use this tool as part of any products that or any work that we send out to them. Before we receive it back, that they have to use a checklist to make sure that everything is in place. Translation management system, specifically translation memory, it's been so wonderful to us. I saw the rates that Natalie had up there, very comparable to what we have, but I have to tell you that this is where we save the money. We saved quite a bit of money because we were able to receive translation memory from one organization, so one vendor, and we would share that with other vendors as well. And so rather than paying for the same words to be translated over and over again, we've been able to receive discounts because we share the translation memory with our agencies. The other benefit of working for a large agency is the expertise. One specific I could mention to you where we've been very fortunate is in developing a style guide. So we have 10 threshold languages, and so we had to develop a style guide for each language. And basically, a style guide is a set of instructions as to what to do, what to translate, what not to translate, and any other instructions that are specific to our organization. And so that's really cut down on any miscommunication with our vendors. It's a living document for us as we kind of do different projects or send out different projects. As we learn, we actually update the style guide to make sure that we share this information with our agencies. Next slide. How to work best with your clients and vendors. We view our internal departments as our clients. And so the most important thing with working with our departments is to communicate. And we actually use what's called team rooms to communicate back and forth in terms of expectations. And what we try to do is involve our departments as much as possible in decision making. Because I think when they're vested, then they're a little more open-minded or a little more tolerant when there are mishaps that come up with a project. And the next slide talking about how to best work with your vendors. Everything in writing, contracts very clear and specific, expectations using a checklist, and then again reviewing it, making sure that everyone's on the same page, providing and updating the style guide, and also sharing translation memory. The last slide is, I'm not a linguist by training or education. The last slide really summarizes what I've learned in the last 2.5 years. I've been very humbled by the fact that there's great experts out there. You know, we have radiologists, we have pediatricians, and we have linguists who are very good at what they do. And so we really need to listen to them. We have to respect them. Communicate is really important, regardless of how small you think the information is. Conveying your ideas, your thoughts, or any information to our vendors or our clients are really important to make sure that everyone is on the same page. Being clear about expectations. So if certain things cannot be delivered by a certain time, then we just need to articulate that so that there's not false expectations. And the other is being very, very flexible. Timeline is always crucial. There are errors, availability of consultants, maybe they're sick or life happens. So we all just need to be flexible and kind of instill that mentality to our client departments. The biggest challenge that we've had within the organization is the fact that it takes more than a few minutes to translate. We always get this request, can you translate this 150-page document in 2 weeks or in 1 week, and that's not possible. So we continuously educate our various departments. We do it on a quarterly basis. We talk about the process. We talk about expectations. For those who are bilingual, many of the bilingual folks kind of get it, but for those who are monolingual, they just don't understand why it doesn't churn out. Yeah, so it just takes more than just a few minutes. And the last statement is educate, 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 because that's what we have to do with our client departments, setting realistic expectations, and letting them know that, you know, we make mistakes, people make mistakes, and it does take more than just a few days to be able to translate a 150-page document. And that's it. And I believe the slide presentations are available on the DiversityRx website.
Great. Thank you, Nai. Thank you very much. And for everyone who's been submitting questions, we are receiving them and we are collecting them to answer at the conclusion of our presentation today. So please continue to submit your questions in your chat window and we'll continue to collect them. So while Carolyn's getting her presentation up for us, I'd like to introduce our third speaker, Carolyn Wang Hong, practice leader with Kaiser Permanente, Northern California region. Actually, her full title is practice leader at Language Access. In her role, she is responsible for providing leadership in developing and implementing a regional strategy for language access, and that includes interpreter and translation services. Her past projects have included the implementation of a bilingual language competency assessment program for unionized employees, implementation of an infrastructure to support quality translation of health plan documents, and design of a cultural and linguistic training curriculum for all employees. She also provides extensive consultation to operations on regulatory and compliance issues related to cultural and linguistic services. Prior to Carolyn's career at Kaiser Permanente, Carolyn served as a cultural and linguistic services consultant at the Alameda Alliance for Health, a Medi-Cal managed care plan, and also worked with the U.S. Department of Health and Human Services Agency for Healthcare Research. So I'll hand it over to Carolyn.
Great. Thank you, Natalie. So just as a quick reminder, I know the other speakers have been reminding everyone as well, but the slides are available on the DiversityRx website as well. So let's see. I'm sorry, all of a sudden okay, here we go. So just a few facts about Kaiser Permanente by way of context. Kaiser Permanente actually refers to an integrated healthcare system of hospital, health plan, as well as medical groups spanning 8 different regions across the United States. I'm going to be speaking with you today specifically on behalf of the Northern California region. The statistics that you see on your slide are reflective of the entire program, but in Northern California, we cover about roughly 3.3 million lives, about 64,000 employees, and 6,500 physicians. So even though we're only one of 8 regions, we're a fairly large region within the company. In terms of context around our translation needs, and I'm going to speak now about the Kaiser regions in California, Northern and Southern California, approximately 11% of our membership prefer to communicate in a non-English language. And when you look at specifically written language preference, the top two languages for us are Spanish and Chinese, and specifically traditional Chinese. When it comes to translation need, we've got over 20 different departments which require either proactive or reactive translation, proactive meaning sending documents out in language to the member, or reactive meaning being able to generate a document in language, typically within a specific time frame. These are usually regulatory letters. Lastly, in California, we've got multiple requirements to translate documents. However, in 2009, we faced new regulations issued by our Department of Managed Healthcare, which required health plans to translate specific documents for our commercial members in our top two languages. And this change was significant for us because it really increased the number of documents we had to translate. But it also meant that something to keep in mind when we talk about translation is there were some systems impacts for us as well. We had over 20 different systems that then needed to be tweaked to somehow support now this extra step of translation in the document generation workflow. For those of you who are looking at increasing your translation capacity, that may be something to keep in mind. So before I talk about our case study in terms of what we implemented, I want to just further set the stage for you that on the previous slide I shared with you the size of our organization, and inevitably one of the key challenges that we faced is in an organization this large, you're bound to have a lot of different perspectives on translation, including whether it's important to do or not, whether it should cost any money, and how quickly it should get done, as well as who should do it. So we were pretty much faced with an uphill battle in terms of this also being a culture change effort within our organization. What we realized was that really this was about 3 or 4 years ago. We were really headed into the perfect storm. We had increased regulatory drivers. The cost of business was always increasing. And, of course, there's always this interest to eliminate inefficiencies. So we really realized that we had to meaningfully integrate translation into the document development process. Otherwise, it was always going to be hard, and it was always going to be very expensive. So where did we start? Honestly, one of the first things that I have to put out there, too, prior to doing any of this work, we really didn't know much about translation at all. Kaiser Permanente has had a long history of interpreter services and expertise in that area, but translation was pretty new for us. And honestly, one of the first things we did was go to a conference of the American Translators Association. It was somewhat of a crash course, but it was very helpful in helping us understand, what's the current thinking about defining quality translation and what infrastructure may be needed and what tools are out there to help us manage efficiency. So what came out of that conference for us was really the approach that you see on the slide here. And that is that first we had to develop quality standards for translation. And actually the regulations I mentioned really required plans to develop quality standards and adhere to them. The second piece was that we needed to set up an infrastructure to support those standards and really make them meaningful in terms of workflow. The third was developing a workflow process based on the standards and employing the infrastructure that was developed. And then lastly, we needed to communicate what those standards and processes were, and this is something that we do every day. We did it 4 years ago, and it's something that we still need to do every day. It's an ongoing task. In terms of quality, you see an acronym up there, SB 853. That refers to California Senate Bill 853, which is the same thing as the regulations I mentioned earlier, that health plans had to implement standards to ensure that translations of documents met the same standards required for English documents. And so this really put the onus on us to define quality translation. And what we did was we worked with a number of departments that had various checklists already in place because they've done a great deal of translation and came together as a group to define what are our internal standards going to be for quality? And I won't read these line for line. You can read them on the slide. But I do want to mention, prior to coming up with this list, we really deferred to our vendors to define and dictate what quality translation meant. And that was a problem because not only did it mean that we had discordant expectations for quality, but it pretty much meant that we gave up oversight for quality translation. We would take a document and have it reviewed, and we would get feedback that, oh, it's good, or oh, it's bad. But we wouldn't get any specific knowledge in terms of how is it good or how is it bad, in what ways. So we really needed to define each of those categories here. And just as Nye mentioned, this is also a dynamic tool for us. As our translation needs continue to evolve, this list of standards will also continue to change. I'm going to spend a little bit more time on this slide because talking about translation infrastructure, I think having the standards is one thing, but not being able to, you really need to make them meaningful. And what that means is you need someone who's accountable for making sure that those standards are employed and that they're maintained and that they're changed over time as needed. The first thing we did here was really develop an infrastructure, and the first piece of that infrastructure is hiring a dedicated project manager to direct translation services. As I mentioned earlier, our organization, we had a lot of expertise in interpreter services. We did not have that same expertise when it came to translation. And so we actually hired someone who used to be a localization manager for a software company and hired her in to really help direct and shape what this infrastructure is. And the second key piece of this is preferred vendors that were committed to using our infrastructure and also using our quality tools. That's something that we had to get their commitment on before working with us. Prior to doing any of this, in our procurement database, we had 40 different translation vendors on the books working with us for different jobs. So we really wanted to whittle that down to a pool of 2 or 3 preferred vendors. Just like LA Care, we also issued a request for proposal and invited vendors to respond to a pretty extensive RFP, questions that included, what's your quality assurance process, tell us about your customer service philosophy, and also what type of experience do you have in translating healthcare documents. We also asked each vendor to complete a set of sample translations for which we provided the source text. So what we did is we gave them a sample of a health ed document, a sample of a clinical consent document, as well as a sample of a health plan document. And then we asked them to translate that as part of their RFP response into our threshold languages. And then it's what I really want to emphasize here is we gave them 2 weeks to turn around their response for the RFP, so full RFP responses as well as the samples. And we did that deliberately because we really wanted to see if they had the internal capacity to provide us a high-quality response on the RFP. We also wanted to see if they had internal capacity to provide the samples back in a limited amount of time, the translation samples. What we learned in this process, it was very interesting. What we learned, as if you think back to the map that Natalie showed, anyone can call themselves a translator is what we learned. There are ATA certifications that are available on a limited basis, but beyond that, there was not a lot of transparency in terms of qualifications for a translator. The other thing that we learned was that when working with these large agencies, consistency can be an issue because anything that can be outsourced will be outsourced. So the number of hands on your project can be significant. As Nye mentioned, wanting your jobs to go to a limited number of linguists, that's something that we also require with our vendors, is that you send our jobs to the same pool of translators. The third thing we learned in the RFP process is that, unfortunately, and an alarming fact was that some vendors that we had worked with in the past essentially failed when it came to a review of their sample translations that they submitted. And so that was very eye-opening in terms of, what does it really mean to be doing quality translation? The third bullet here is editors and proofreaders. We wanted to insert an extra layer of review, as all of our vendors do the translation, edit, proofing workflow. But we also wanted an extra set of eyes that could really review it from the perspective of Kaiser Permanente. And we did this because we don't have internal bandwidth and internal reviewers in all of these different languages to be able to do this. But we do have relationships with freelance editors that we had been working with for several years who were very familiar with our KP brand and our quality guidelines. And we essentially employed them to act as a third party and review those documents on behalf of Kaiser Permanente. The last three parts of our infrastructure are really rooted around technology and tools, and both Natalie and I talked about translation memory. We do require that all of our vendors use translation memory for all of our jobs, and how it works for us is we ask them to return translation memory files to us on a monthly basis. Our project manager then reviews it and combines that memory and then sends it back out to all of our vendors, and the expectation is that future price quotes then are provided to us based on what that entire memory encompasses. I want to just really emphasize here that translation memory, we consider it intellectual property of Kaiser Permanente, and I would really urge you that as you're working with vendors and negotiating with them, that you make it very clear that the translation memory files for the work that you send are your property. You can take them with you. You can take them in a portable format with you so that you can use them in future relationships with other vendors if need be. But we found that not all vendors have that stance. Similar to LA Care, we've also developed style guides in Chinese and Spanish. We've also developed a glossary of terms that is in multiple languages as well, and this is something that we give to our vendors and reviewers, again, to ensure consistency in the terminology that we're using. On this slide is a visual depiction of a very generic translation workflow process. So really, our main goals here in developing a workflow process was making sure that it was going to be easy for the end users, but it would support the quality framework that we had developed. And so you'll see starting on the left, the steps are sort of A, B, C, D around the slide here. But essentially, our requester sends the document for translation. We have a generic email box that's set up for translation requests. We've also developed a KP requester form, which you'll see there, which basically is a form that helps the requester understand the pieces of information that the translator is going to need to know in order to do a good job in translating that document. It's optional as to whether or not the requester wants to complete that form. We used it initially as an educational tool more than anything. Once the job is sent, there's a quote proposal that's generated, and then depending on that quote, the job is either approved or sent to a different vendor for performance of the job. The vendor then completes the job using all of our linguistic tools, so the glossaries, the memory, the style guides, and then we have it reviewed using the KP editor and reviewer checklist, which is based on the quality standards that were outlined on the previous slide. There could be some back and forth here at this point of the workflow, depending on if there's feedback back to the requester on questions about the job. And then once it's done, the job is sent back to the requester, and then updates are made to the glossary and the memory and all of the other tools that we have in place. Lastly, I just want to touch on communication. For us, as I mentioned, this was really a culture change effort for us. Going into this, we had 40 different vendors, people thinking that interpreters could do the translation, thinking that translation could be done quickly without cost. So in promoting this service, we really had to use different key messages which spoke to different audiences and made this relevant to them. As you can see here, these are just some of the key messages that we've used. You can see the first is around pricing, so really encouraging people that the more we use these vendors, the more the memory grows, the lower we all pay eventually. The second message being around quality, so really the importance of using consistent terms to support quality translation, and then of course efficiency being one of the main drivers, is that as we grow our memory, we'll have to pay less, and then the translation process may also be a lot more efficient in terms of time as well if there's a lot of previously translated content. So in conclusion, I would say our case study is ongoing. We're at a point where users know now that there are requirements for translation quality and there's a resource to go to. But as I mentioned earlier, we still work every day to really make sure that the messaging is clear around the importance of using qualified resources and making sure that our patients get the clearest information possible. So with that, I'll pass it back to Natalie.
Great. Thank you very much, Carolyn. So now we're moving into the question and answer portion of today's webinar. And we have been collecting your questions as we've been going along, but if you have additional questions, don't hesitate to type them into your chat window. So the first section of questions that we have relate to the review process. And we have a question from one participant who specifically wants to know regarding Spanish, how, Nye and Carolyn, if you can discuss how Spanish is treated, given that there are so many different regional varieties of Spanish and many different ways to say or translate different things. Nye, would you like to speak?
Sure. Yeah. So in Southern California and within our membership, we see Spanish-speaking individuals from Mexico and Central America. And so we actually make sure that our Spanish is in line with the folks who migrate from those parts of Latin America. In the RFP process, we made sure that it's not good enough just to have it in Spanish, but our preference, if possible, is to find translators or linguists living in Los Angeles, because I think LA is very unique in terms of the way it functions here. We have some unique challenges, traffic, congestion, crowding, and so when we selected our vendor, that was something that we articulated clearly.
Great. And Carolyn, did you want to comment on that as well?
I would just add, the style guides that we've developed for Spanish and Chinese have been very helpful in really articulating, for Kaiser Permanente Northern California, the demographics of our Spanish-speaking members, come primarily from these countries, and being able to very clearly articulate that to our vendors as well. But I would agree with Nye, our reviewer is also based in the Bay Area, Spanish-speaking reviewer is based in the Bay Area, and so we're very sensitive to, the demographic within our particular region. The last thing I would just offer is we have also, upon occasion, employed some of our Spanish-speaking interpreter translators who are out in the field to review documents as well, because, they're also very familiar with, as language shifts as well, and they're familiar with, the current words that are being used with a particular dialect and whatnot. So we really try to, it's a very local issue in terms of the resources that we use.
Thank you. Now, could each of you discuss a little bit about, related to your review selection process? In other words, how are you finding your internal reviewers and what are their qualifications? This is a question from one of the participants. Nye, could you discuss that first? Related to internal reviewers?
Hold on. Okay, sorry about that. We have a linguist who is our translation project coordinator, and she has a master's in translation, so we're very fortunate in having the internal expertise. But because of the volume, we actually outsource the majority of our work, and any review that we do in-house, they're very minimal. And then in terms of the quality assurance, we work with agencies that have this multi-tier review process where the expectation is the proofreader and the quality assurance person has more experience than the translator.
Mm-hmm. Great. And I can also comment here that sometimes the vendor can assist in helping you develop a profile if you are looking for individuals to serve as client reviewers, internal reviewers. Sometimes they can help in that selection process to make sure that those individuals actually have the language skills required. Sometimes the vendors will find that someone who doesn't actually speak the language natively ends up being a client reviewer, so it can be frustrating on the vendor side. So another question with regard to the translation memory, and this question is for Nye. One of the participants wants to know, is this tool something that you purchased and that you manage internally, or is that something that is managed externally?
So the translation memory is collected, as Carolyn was mentioning in her presentation. We actually collect it from our vendors on a regular basis, and we then distribute it to our other agencies. So we don't have the software ourselves, and the program is in all the terminology is in Trados. So we don't have the program in-house, but what we do is we collect it via CD, and we just share it with our other vendors.
Okay. And Trados is a product that is produced by SDL, which also produces several other translation management systems. It's one of 24 different tools that is used in the industry that we have evaluated. Common Sense Advisory has produced scorecards for these products. And Carolyn, could you also discuss translation memory? Is that something that you purchased as well?
We did. We did purchase Trados because our project manager, she will do some alignment of the memory as she gets it from the different vendors. So we did make the investment to go ahead and purchase it. But that's primarily because she's got the technical skills to manage it in-house.
Thank you. One participant is raising the issue of machine translation, internet translation sites. Is that something that either of you have come across in your process of educating your end users, and if so, what comments have you been able to share on that?
You know, we don't support it here. I know some of the staff members have mentioned, can't you just do it by machine, or isn't it done that way? And quite frankly, we're really concerned about quality of material because our members are those with low literacy, not only in English, but from other respective countries. And so we're very mindful of quality and quality assurance. And so as soon as someone brings it up, we right away do some education and let them know that that's not what we choose to do, and that does not guarantee or even produce quality translation.
Thank you.
Yeah, I would agree. I think that it's an issue. It's a very, very real issue for us that still it comes up periodically as well. I think people are really tempted to use Google Translate, and we've written communications out to the field as well, just really outlining the risk of using those types of tools. I would say one of the most effective things we've done is taken some patient instructions, translated them in Google Translate, and then back translated it back into English, which I know is not, it's not 100% accurate, but the point is to show that the message definitely gets jumbled. And so that's just one way we've really tried to illustrate, especially with a clinical audience, that it's not okay to use those tools to really be translating any of our content.
Definitely. And another thing that you can share if this question comes up in your practice or your organization is the fact that these tools are not meant to be used as part of a professional translation process for the healthcare setting. These are, in the case of Google Translate and some of the others that are out on the market, are primarily being used for different purposes than what your purposes are as a healthcare organization seeking a professional translation service. So another question is coming up regarding ATA certification. Many healthcare organizations are requesting their vendors to provide ATA certification instead of experience in healthcare. Can either of you comment on ATA certification? If not, I can share.
Natalie, you probably know more about this. I mean, we do require that. We look at a number of different things. Our editors and reviewers definitely have ATA certification, but it's in our business. There's so much regulation, and there's so much of a need to really demonstrate competency. And in the absence of having anything specific for healthcare translation, that's really what we've relied on in terms of being able to use a standardized metric, I guess you could say, to really be able to demonstrate competency. But it certainly is not only the only piece. It's coupled with all of this editor review and these other components that really need to go hand in hand. I wouldn't say that that alone is going to vouch for a really great healthcare translator.
Yeah. And then from our perspective, we recognize that the ATA to attain ATA certification, the requirements are quite minimal. What we ask our agencies to do is to document their experience and conduct an internal assessment, and that they have to have some sort of training, regular training in place. So that although the certification is nice and it would be great if the industry had some sort of standard, national standard, we look at other activities to ensure quality.
Mm-hmm. And to add to that, as Nye mentioned in her presentation earlier, individuals may come and go, and even though both Nye and Carolyn have touched on the importance of trying to make sure that you have the same translators working with you each time, people go on vacation, they get sick, it's possible that you might not have the same translator each time. And the ATA, which the American Translators Association certification for individual translators, well, it's a great certification. There are only a limited number of languages for which it's available. It doesn't cover every single language that you could possibly request. So that's something to keep in mind as well. Here's a question for Carolyn. In defining your standards for translation quality, did you refer to any of the published translation industry quality standards, like the one from ASTM?
I'm not sure. I don't think we looked specifically at the ASTM ones. We looked at a lot of things that were already available on the ATA website as well, and even through our California Healthcare Interpreting Group that has some expertise in the translation area as well. So we looked outside, and then, as I mentioned, at the ATA conference, that was a wealth of opportunity to understand, what's the status of quality in the translation arena. So we took that and then coupled it with, as I mentioned, several internal checklists that were already in place.
Great. Thank you. And I can add here, there are many, many quality standards out there, not just ASTM, but there's ISO, there's FMEA, UNI, IEC, LISA QA model. There are many, many out there. So really looking at the process is very important because many of these serve as specifications for specific process steps. Another question for Carolyn, who collaborated on the creation of your glossary of terms, and what was their background in the organization?
Yeah, so we're actually very fortunate because in our organization, we've got lots of different layers, and our corporate office actually had developed various trilingual reference manuals and had sort of a seed glossary that was in place already. Some of you may have seen the Kaiser Permanente trilingual reference manuals that are available in numerous languages. So we took that and then basically grew that as we started to do more translation. What we asked our requesters to do is, if they were coming across terms that were used over and over again, could they send them to us? And then what we did is we worked with our editors and reviewers as sort of a subcommittee and reviewed the terms and said, does this align with a KP brand? Would you support adding this into our glossary? And then based on that decision, we would go ahead and add it. One of the things that we are just about to publish is actually an online version of our glossary so that internal stakeholders can use that and look at it and identify terms if they need to, but then they can also provide feedback and comments to us on, maybe this term should be included or that term is outdated, so making it a little bit more interactive as well, because right now they're primarily in an Excel format, which is not as user-friendly.
Yeah.
Great.
Can I speak to that real quick, too?
Sure.
We've actually begun that process as well.
Great.
And we involve not only internal but our subcontracting agencies. And we've contracted with UCSF, and they were able to pull in linguists. And so it was done by a committee kind of review. And we do have that posted on an electronic database. So there's a mechanism where if individuals disagree, then they can actually communicate that on the database. And we made this available to all our vendors as well as our subcontracted agencies and their vendors as well, too.
Excellent. So we've received a couple of questions related to whether or not the practices that we've been outlining today would actually apply for smaller organizations, given that both of the presenters are from organizations that are quite large compared to some small hospitals and small healthcare providers. So could each of you talk briefly about your view on whether or not some of the practices are applicable in small settings, and if so, which ones you think are most important?
I can start. I would say definitely the vendor management pieces are going to be applicable as long as you're going to outsource any of your work, even if it's just a small amount. Definitely the tips around how to work with a vendor and knowing that the TM is your property and things like that. I think that in a small organization, too, the TM is still just as valuable because I think as long as you're storing your content, you'll be able to leverage it in the future. So I would definitely say that is a valid tool. The other piece I think that is probably going to be most valuable is this area that I think, Natalie, you mentioned, this sort of creative contracting, that even if you have a lot of small jobs, is there a way to get around a minimum fee? Because I think, that has been a big issue for us, and we do have an agency that's agreed to not have minimum fees and looking at volume thresholds instead, and I think that type of creative arrangement is going to be very important.
Great. And Nye, do you have any thoughts to share on that?
Yeah, our agency is relatively young in comparison to Kaiser, and so we actually worked with independent consultants, and I think that worked really well for a small organization, small meaning like volume-wise smaller than what we currently have. And so I would strongly encourage finding the qualified linguist to be your primary translators. And like Carolyn mentioned, having translation memory would be helpful. Also, developing something that looks like a style guide. It doesn't have to be, it has a fancy name, but it doesn't have to be fancy. Maybe some basic instructions that you want someone else to know, someone who's not familiar with the organization or the processes. And what I would say is just start from there and kind of build upon it, because I think it's taken us many, many years to kind of get to our place. But I think starting out small with quality in mind is a very good step, good first steps.
Great feedback from both of you regarding that question. I'd like to add, for small organizations, the rates that you saw up on those slides are the average industry rates, and I think one of the ways that you would be most affected if you were a large organization is you get the volume discount. So unfortunately, the smaller organizations tend to not benefit from the pricing discounts. However, the sooner you can start to use translation memory and begin to leverage that, the more cost savings you will realize later down the line. So that's definitely not something that you need to wait until you're at a high volume level to begin to use.
One more thing I just want to suggest too, is I know up here in Alameda County, for example, there's somewhat of a collaborative that's happening as well, where lots of small organizations are pooling together to form relationships with vendors. So that might be another option in terms of trying to get to those volume discounts and collaborating with other similar organizations who have similar translation needs.
It's definitely a good suggestion. Purchasing cooperatives can be a great way to gain access to those lower costs and discounts, and even sharing translation memory in some cases. So another group of questions we have related to readability standards. One participant comments, even well-translated materials can increase complexity and grade level of written materials. So how are you ensuring that translations are developed at the necessary literacy levels for your populations? Naya, would you like to address that? Or Carolyn, do you have thoughts to share on that?
I would say that's still a continual challenge, because we don't have a lot of tools to measure readability in other languages. So we reinforce in our style guide and outline the different types of documents and their reading grade level. And a lot of it is working with the folks that generate the source documents to make sure that in English it's at the right grade level before we begin to translate it. We also do include on our editor reviewer checklist that, is it at a certain grade level in language? But beyond that, we haven't found a tool that really measures the readability like you would find in English.
Okay.
And, I'll second that because with English, you can use the Microsoft Word and the word count, and it gives you Flesch-Kincaid assessment that tells you the grade level, but there's no such thing with the other languages, unfortunately. But I agree with Carolyn. If the source document is at a lower reading level and it's very explicit in the style guide that the reading level has to be at a certain grade, 6th grade or whatever grade or below, then I think that's the best way of assuring that you're going to receive lower registered translation. But unfortunately, there isn't a tool that's available in other languages to measure the readability.
Great. Thank you for that feedback. And now we just have time for one more question. And one participant is asking, how do you determine which materials get translated and which ones do not?
Well, for us, a lot of it is driven from a regulatory perspective. There's definitions of what vital documents, what types of documents would be considered vital, and that varies by business line for us. So for our Medicaid product versus our commercial product, the bulk of the translation, I would say, is really driven from that perspective. Of course, there's always clinical and business need as well, and so unfortunately, the processes really vary by department. If it's a document coming from a specific facility, for instance, where they know they have, say, a high Vietnamese-speaking population, they'll also make the business decision to translate it into that language as well. But the bulk of it, I would say, is driven by regulation for us in terms of what we have to translate.
And that's true for LA Care as well. But I think we're also very fortunate to live in a state where now that there are requirements in state law, there's more awareness. And so, we're looking at other documents to translate. And many of the certain departments welcome that, such as health education, where they want information in different languages. Because a patient calls and is asking for something in simplified Chinese, or in sales and outreach, or sales and marketing, for instance, if they are looking to kind of outreach to other ethnic groups, then they're looking to have it in other languages outside of English and Spanish.
Great. Thanks to both of you for your responses to these questions, and thanks to everyone among the participants who has been very active in providing us with a lot of questions. Unfortunately, too many for us to get to in this session, but we will try to respond to some of the remaining questions in writing and post them to the website for the webinar. The slides are also available on the site right now, and the recording will be available on the site next week. So I'd like to go ahead and, with much thanks to Nye and Carolyn for sharing your experiences, hand it back to Julia, who has some closing slides to share with us.
Actually, you managed to get everything I was going to say in my closing slides in your closing. So I just really would like to thank you, Natalie, for helping us organize this webinar, and to both Carolyn and Nye for their really excellent presentations, some terrific content there. We really appreciate it. And to let you know that in addition to all of the materials being available on the website, we're happy to announce that our next webinar is going to be on NCQA's new multicultural health standards, and it will be on April 1st at 1 p.m. Eastern Daylight Time. And if you've signed up for this webinar, then we will be able to send you information about that April webinar, and hope that you'll be able to join us. So again, thank you to our presenters, thank you to the behind-the-scenes technical people, and we look forward to seeing you again.